Hello. Hello, everybody. My name is Leo Blitnitsky, and we're about to start this webinar. We're going to give it just another maybe minute for some more people to jump on, and we'll start the discussion. Maybe to start, we'll do a quick go around the speakers. They can introduce themselves, and then we'll get going. So start with Mitchell.
Hello, good afternoon, everybody. Thank you for joining us. My name is Mitchell Fong. I'm currently the CEO, founder of Innovise Consulting, where we help with digital transformation for providers, and we help healthcare technology companies with their growth and strategic differentiation, as well as making sure we get a meaningful use for their technology and their application. My background is in healthcare administration. I am the immediate past president for ACHU Nevada, and currently on the HIMSS Nevada board. And I have a passion for helping people with technology, where I served as a technology innovator and leader for Renown Health and Hometown Health for many years.
Excellent. Brian?
Hi, Brian Rosenberg. So I wear a few different hats. I am the president of the Nevada chapter of HIMSS. I am an adjunct professor at UNLV. I've been a professional consultant and industry leader in implementation of technology in the healthcare for almost 30 years. And helping out with everything from HR implementations to large-scale operational change. I've had that experience both working as at KPMG as a partner, leading clinical technology strategy, as well as with my own firm before moving here to Las Vegas. I was involved in some big projects such as the Epic implementation at UMC. I'm an honorary commander at Nellis Air Force Base for the hospital there. Do a lot of speaking on AI and how it's changing healthcare and helping companies with their AI strategy.
Fantastic. And Thomas? And Thomas, you are muted.
Of course, the technology guy doesn't know how to use technology. So yes, Thomas Wong, I'm one of the co-founders and chief AI innovation officer for Avacom AI. And I'm here to, help talk about AI as beyond chat. How are we able to communicate better and take tasks better? Accomplish tasks better. And currently, we're just working with a lot of leading technologists on the cutting edge in Silicon Valley, in Nevada, and globally to help take AI to the next level. And so I'll just turn it back to you guys.
Fantastic. And again, my name is Leo Blitnitsky. I'm the president and CEO of Healthy Technology Solutions. We're an IT managed services provider supporting medical practices and other organizations in Southern Nevada as well as Central Florida. I wear a number of other hats, but I will skip that part for now. So to kick this off, I know that both Mitchell and Brian attended the Las Vegas, the National HIMSS event in Las Vegas, which really is, the preeminent technology event for healthcare in the country. And I wanted to see if they could maybe talk about some of the cool things they saw and what really resonated with them.
Well, I guess I'll start off that certainly AI was discussed a lot at that conference. I think was probably the major thing. And I think as we get into some of this conversation, it's interesting because I think that there's starting to be a transition from talking about AI as a concept to getting practical. I think people are a little tired of hearing the big picture about AI and thinking more about what can I actually do with it today. Where is this going? What does this mean for me? And some of that, both interest and fatigue on that topic, came out in that conference as well. But it's for those of you not familiar with the HIMSS National Conference, it is the largest healthcare technology conference in the world. It's about 35,000 attendees. We were happy to be the host here in Las Vegas, both this year and last year. Unfortunately, I will not be back here to Vegas for I believe 3 years, as other cities apparently get to have a turn. But but it was a very well attended, very large event. There were over 1,000 different vendors, and hundreds, if not thousands, of different conferences. And as a HIMSS chapter president here in Nevada, I've mentioned that we were heavily involved in that conference. We had speakers at the academic forum where I personally spoke, at the public health forum, at the Native American symposium, and then had a general session talking about a project being run out of UNLV. So it was exciting, and for those of you who did not get the opportunity to attend, I encourage you to get involved in the HIMSS chapter locally and to attend those in the future.
Yeah, I guess I'll just piggyback off what Brian said and think it was a great event, very large. I'd love you guys all to join HIMSS in our local chapter. I think what I saw as key themes was a driver, as Brian said, to value, looking at how do we quantify the ROI and the impact of technology, but most importantly, how do we build around the human elements of healthcare? So we're not just putting technology in to solve gaps, which we want to do, but we want to make sure that it's adding value within the workflow and creating and deepening those human relationships within healthcare. I say as a theme, I think that was a theme, but obviously we saw a lot of consumer-based technology rolling out to be an extension of the provider and the care teams, as well as the payers. And so excited about today's topic, because I think that will have a lot of overlap with what we were able to see at the event.
Fantastic. And were there any specific products or AI solutions that really jumped out at you that would be pertinent for our discussion today?
Loaded question. Without being biased, I don't want to name vendors unless we had a certain sponsor we wanted to highlight. But for me, I'd say the themes that I saw, I think, was care coordination and patient management. Navigation was one that's really going out. Obviously, with your virtual assistants, your AIs, kind of your healthcare GPTs, I think those are other ones that we're seeing. And then a big theme on interoperability, really around how do we use data and how do we have a single source of reliable truth if we are going to use AI to layer. So it encompasses all your healthcare data, but also is consistent in what that messaging is. I'll say thematically, that's kind of what I heard, but Brian, I don't know if you saw something different.
I think it's interesting, important to mention that the care coordination and interoperability are weaknesses in our industry that the big EHRs don't fix on their own, right? And as a result, I think that that's where a lot of opportunity is, and interoperability is something. I'm on the board of the Health Information Exchange, Health in Nevada here in the state. It's something I'm a big believer in, and the importance of that. I think both of those are areas where our industry has weaknesses that AI can help to bridge the gap between how we're sharing information and how we're coordinating care outside of the scope of a single organization.
Fantastic. And Thomas, you were recently at a different show, but I don't think it wasn't healthcare or AI specific, but it was all about security and most likely AI security. Any tidbits there that you want to bring up before we really dive into the meat and potatoes of this?
Yeah, absolutely. That's the other piece of it that we have to tread carefully, because there's some, if you have multiple systems and you have a consumer, you have the care provider, and you have other parties involved, how's that information shared in a secure, private way? And also what comes into play is the willingness of each of those parties to share it and the legality. So it's a complex issue that you have to take a look at it from multiple lenses, and hopefully work together to have it where it's secure, it's private, and it's the interoperability is efficient.
Absolutely. One of the big topic here is, are patients using AI? And the obvious answer is yes. So if the patients are using AI, is this a problem for healthcare providers and organizations? How can healthcare organizations really utilize AI or I guess, interact with the patients who are self-diagnosing they're coming up with, they're self-diagnosing, they're coming up with treatment plans based on what Copilot or ChatGPT or Gemini told them to do, and then bringing that to the practices.
There's a
So
lot
what
of
are the thoughts?
concern. There's a lot of concern about that idea of self-diagnosing, right, and in using AI. But I think it's important to recognize right off the bat that patients have been self-diagnosing since the beginning of time, and it's really a question of what kind of information do they have to work with in self-diagnosing. So I think that it's not a question of where a patient's going to self-diagnose. It's a question of, are they going to self-diagnose using AI, using something that's very focused on that, using WebMD, which is something the industry's been concerned about for years, or calling up grandma. Ultimately, everybody and anybody who's been a parent knows that their kids have headaches all the time, and stomach aches and stuff. And you just can't go to the doctor every time there's an issue, and so you look things up, and you call people, and you get experience, and you make decisions based upon that. That's normal. We have our brains, our large language models that have information, the history that we've learned, and we react to that information based on the information we have. So the question really is about, is not our patients going to self-diagnose? Because they are. And certainly they're going to do even more so because we have a problem as an industry that it's sometimes taking a really long time to get in to see a primary care doctor. And so the better question is it more helpful information than the other things we mentioned? And I think that because AI has the potential to look at your unique data, right, your unique information, should you choose to share it. It has history about you that WebMD may not. Grandma may have it, but WebMD doesn't. And it also it can have your blood work results, it can have your lab test results, whatever, it can have whatever history you choose to share with it, and it can make more informed decisions. So it's an important element of this. And I think it's important to recognize too that patients are going to self-diagnose regardless of whether or not as an industry we want them to or think we have control over that. And they're going to use AI to self-diagnose, regardless of whether we want them to or have control over that. The question is, what are the best tools we can put them in and allow them to be able to do so, and direct them towards the most effective tools that they could possibly be using for that purpose. Just starting as a foundation to recognize that self-diagnosing is natural.
So should practices provide a platform for their patients to do that self-diagnosing, maybe a small language model, because the AI does not need to know about current events or or the war in Iran. It just needs that that medical knowledge in order to be able to provide real answers without maybe with a little bit less bias. So should they control that, and what are the next steps there?
Yeah, I guess I'll jump in and say I think this is a theme that we're seeing across the country for sure, is how do we get upstream on that, and how do we try to manage and navigate the patients as best as possible? I guess I'll take a step back and say, I think as we're thinking about the patients and what Brian talked about, which I agree with completely, is more about how do we educate the patient about the utility and the value of the AI. And what I mean by that is, am I using the AI to self-diagnose or to become educated and aware of my condition so that I can bring the appropriate questions to the provider when I interact with them, instead of bringing a AI generated diagnosis? Because I think you're going to get a lot more value from that conversation with the provider if you're using that AI to say, here are a few different things that it might be, here are appropriate questions to ask and things you might want to do to self-manage in between now and when you see your provider. That to me is an appropriate use for a patient to be using that, because you're bridging that gap, but you're also enhancing your literacy. So when you go to the doctor, you can have a better conversation. And we know that you have very limited time with the physicians. And so maximizing that time with appropriate questions that are going to drive value for you, I think is an important way that we use the AI from a consumer basis. And then how that translates then to the tools that the providers use. I think one is knowing the tools that are out there and your patients are using. Two, to your point, a lot of people are going to, can we build our own version of a healthcare GPT, if you will, that's within our patient portal, so they can ask those questions and we can have it navigate to who's in network for our system or your insurance carrier, et cetera. I think those are very meaningful, practical ways that we can use AI, and providers should be thinking about what are some of those questions that are commonly asked that we want to automate and have AI be able to provide answers to. And then secondly, how are there escalation points? If that's a more complex question and it really should go to a nurse call line or a provider's office to be answered, how do we direct the patient and create a warm handoff using the AI kind of as that initial touch point to triage the patient and get them some immediate support, but then allow it to be addressed and handled at the right level with the right license from that provider and care team. So I know I might not be hitting that question directly on the head, but I think that's kind of my take on how we're thinking about how should we be influencing that consumer-based AI from a diagnosis and education standpoint.
But Mitchell, I think that's right thinking, right? We have to influence it. We have to advise and we have to provide tools or guide them to tools. Because if not, they're going to experiment and work that out on their own, and they may or may not make the best choices with that. And also we shouldn't be afraid of that we use tools in the industry, whether it be an open evidence or some type of a way to look up clinical information. We do that ourselves, right? And we're going to be using AI tools within the industry as well in order to be able to make more informed decisions. So I think that these consumer-facing tools are a natural evolution of where we're going, that there's a lot of opportunity, and that in the end, they're going to allow patients to make wiser decisions when they are self-diagnosing. And Mitchell, I think your point's really important. Ask smarter questions when they do get that time with the doctors.
Yeah.
Go ahead, Thomas.
Oh, yes. As we're studying how AI is used, from the application development standpoint, one interesting concept is that you can actually now use agents or AI to test the AI results. So rather than, hopefully we actually develop a system to where, hey, where did you get these results or responses? And then we either have to build a tool that kind of analyzes it and make sure that that's really what the data that was gathered from the consumer is really what the intent is, and then how is that data analyzed and used by the medical provider. So it's really that whole process. Hopefully we make it more transparent, and it's something where as much as possible we get the validation and get the right kind of data and the intent correct. And then that way, if a lot of that's done on the front end, then the interaction with the physician at the end, better data in, better analysis, and better conversation.
One of the things that I know that from talking to both, to regular clients about technology issues or just anybody, when somebody hears the same, when you tell somebody something, they may or may not believe you, but if they've heard it 3 times before, then when you say it, they believe it more. So when a provider tells them something that they've already read from a self-diagnosis, hey, you should do these 5 things, and then the provider comes back and says, here's 6 things you should do. They're thinking, wow, this not only is it confirming, or it's the AI pre-confirmed what the doctor said, plus there's this other tidbit that AI didn't know about. So it potentially elevates what that provider is saying, and maybe make the patient a little bit more compliant with both the diagnosis and the plan.
It's like getting a second opinion, right? Ultimately, it operates as a second opinion, as a validation. I think it is important to educate people to get that second opinion of anything of significance, right? Because one thing we also recognize is that AI has a tendency to be self-affirming, to agree with you. It's one of the things that will get better, but it is reality of many of the consumer-facing tools. When you think about something like OpenAI's new health tool, for example, based on ChatGPT, is that sometimes AI can be affirming what you think. And what you tell and you believe, because it wants to give you an answer and it wants to make you happy. And so that's just a consideration in that as well. And that's part of where I think advising people to say, hey, using tools is a good idea. Let's get you to the right ones. Let's get you, and let's make sure that anything of significance that you're talking to me about it. And coming to me with informed questions. There's a reality that doctors don't have a lot of time to spend with patients, especially in primary care. And with reimbursements what they are, with the number of patients that are expected to squeeze in per hour, unless you have concierge or direct primary care, you probably don't get a lot of time with your doctor. So there's nothing wrong with going in there with a list of pre-prepared questions and having that worked out. And honestly, the reality of it is that the data analysis that you could do beforehand with AI or with a consumer-facing tool might be far more than the doctor could ever do in the amount of time that they have to spend with you.
No, absolutely. Now, one question is, if you're going to prevent, if the providers or health plans or somebody's going to provide a GPT that patients can query, that maybe, one that's secure because they're not violating their own privacy, who should do that? Should it be the health plan, the insurance company? Should it be the individual practice? But then, do you want the patients to have to go to 5 different portals, their cardiologist portal, their primary care, their nephrologist, whatever the case might be? Or does it make sense for it to be more central and have a single kind of intelligent, AI model for healthcare?
Well, I'm going to let these other two respond to that first because I have some strong opinions on this one. But
I'll take a stab. It's actually the question of who is going to manage and operate that. I mean, do we really want a hospital go into the data science and app building, industry, and what kind of expertise do they have, right? So, and then same thing, if you create a government agency or a third-party agency, what's the expertise behind it and what's the infrastructure? And then we got to talk about, scalability. You have to talk about security, privacy, all those same things of almost like building a new business, right? What goes into it? Who's the decision makers? So it's very complex when you get into who's going to be responsible for that. And then, of course, who wants to take the lawsuits that come along with it, right? How do we handle that?
That's the big question, the legal liability. What's your thoughts, Mitchell and Brian?
I guess I'll piggyback and say I agree that all the stakeholders need to be at the table. I think that's the biggest challenge, is for it to have that utility. You want to have your payers, your providers, your hospitals, your patients, et cetera, all at the table and represented for whoever creates that. I think in a theoretical world, it would be one central tool like a Google search that's trustworthy, reliable, specific for healthcare. But also in an ideal world, we would have one EHR and all of our data would be in one system. And that's just not the reality of how healthcare works. So I think when we look at it today, the reality is you're probably going to have many different tools that are healthcare specific, from your insurance provider, from your primary care doctor, et cetera. And that's just likely how it's going to have to be, at least in the near term. Maybe in the long term, things can change within healthcare in our nation. But I just think the way that medical records are distributed and claims are separate from medical records, et cetera, to really get that holistic view, it's going to be very different. And maybe there's a way that we look at data aggregators over time, like an HIE, et cetera, where that's kind of the source of truth for your data. And then we can have a partner, a health specific GPT partner that's trustworthy and reliable, that can interoperate with those to create that single source of truth. I just don't think that's realistic in the near term. What we're going to see is likely each of those systems having their own. And the good part about that is, particularly from an insurance side, you're going to have that cater to what's in network for that provider and their specific plan. And similarly, from a hospital or health system, they're going to be pointing to what's in network within their system, the different offices or provider specialists they have there. So I think there'll be some control, which could be good or bad, as long as you're aware of kind of who's managing the GPT and the information that's going into their data set.
The first thing I want to just point out first up is the question of just who has your medical records, right? Because I think we have a lot of concern about privacy of our medical records without realizing to the extent to which the information is already out there.
Brian, you mean other than the dark web?
Well, yeah. If you think about, first off, the question of how did OpenAI create ChatGPT Health in that where did they get all the medical information? Well, you know where they got it? They got tens of millions of medical records from a company called BeWell, which is a patient portal that provided them with anonymized medical records, but medical records, so they would have information to train that model. So there's a good chance that most of the people on this phone call helped to train ChatGPT Health with your personal information without any acknowledgement, any awareness, any permission, certainly no compensation. Epic probably has your medical records and is using that to train their AI models. I don't think anybody here is getting a check from Epic as a thank you for that, and or gave permission to Epic to do that, but that's what happens. And the third person, to your point, Leo, that has your medical records is probably Russian hackers because they stole almost 100 million medical records from Change Healthcare about a year ago, and that exposed massive amounts of healthcare information. Plus, hospitals are getting hacked all the time. So I just point out that there's an incredible amount of health information out there. That doesn't mean you shouldn't protect it. I'm just expressing a reality. And I think it's a fundamental flaw in the way we think about medical information sharing that right now, without your permission, your medical records can be shared with for-profit companies for the purpose of monetizing your data without your permission. But you have to check a box giving permission for your medical information to be shared between providers in this state for the purpose of providing you with medical care. And I think that's important to realize that patients have to take more control over their own healthcare information. And that means both encouraging and proactively pushing the sharing of medical information between your own providers by supporting things like the Health Information Exchange, and getting away from this idea that hospitals or doctors own your data, patients own their data, and need to be taking control of it, be aware of where it's going, be aware of who has it, and not be afraid to use it for their own purposes, for their own health. Now, you do want to be protective of it. I just think it's always important in this conversation to frame it in the reality of it that your medical information is being shared all over the place without your permission right now.
No, absolutely. And from that standpoint, there is not any shortage of data. So now it's really easy to generate your own data. I mean, everyone has a smartwatch. Well, almost everyone has a smartwatch that's monitoring your oxygen. It's monitoring your pulse. It's monitoring how many steps a day you've taken. And some of the more advanced things are monitoring glucose and many other markers, including EKGs. So there's all of that data. Right now, it's flowing, in most cases, nowhere. It's going to your phone, it's going to maybe some kind of a health app that you have, Samsung Health or Google Health or whatever the case might be, but it's not being used other than personally, occasionally to glance at it. And yes, I did my 10,000 steps today. How can that data be integrated with AI, to be able to provide better support for the patients? And also, as you get later on in life, better aging in place, because there's a lot of monitors, a lot of fall detection. There's so much data out there, so many capabilities to monitor people. Where is this going, and what should healthcare organizations be looking at in order to utilize this data better to be able to provide better care?
Well, right now it's a bunch of silos, right? And there's no integration, and there's a lot of the things are happening even we're not aware of, and some of these companies don't necessarily want to give it out. They're still trying to figure out how do we utilize this and monetize it, right? So in a way, the industry hasn't matured, or it needs transformation, and really be able to. We ourselves as consumers, we're not as educated. Some of these things we don't know we don't even think about it, right? We're just using it for our own purposes, but then don't know that it's being used by the companies that we buy from, and so there's a whole process of understanding that, and forming organizations that advocate for consumers, or using applications, building applications to address those.
I think it's not a question necessarily of not being, you mentioned not being mature. It's not that we can't do these things, right? It's that we don't as an industry, because either we have legal barriers or because we are siloed, or the fact that we have for-profit organizations that don't necessarily want to share information with each other because they're worried about competitiveness, right? And we certainly have the technical capability, and through mechanisms like exchange of healthcare records through HIEs and other things, we have ways to do this. I think that in the end, when we talk about AI, right? AI is powered by data. AI is more accurate the more data it has. And people talk about hallucinations. Hallucinations are ultimately the result of bad data being in these systems. I mean, because if you use a ChatGPT, ChatGPT is trained on the internet, and I hate to break it to you, but not everything on the internet's true. So as a result, sometimes it's going to give bad information, which is why having localized small language models is an important aspect of what's going to work for industry. But we have to stop being afraid of sharing information for the right purposes, and sharing information with the people who are part of our care chain, or have an interest in looking out for our health. And honestly, silos about like making it hard to share medical information between providers need to be broken down. That we really, bottom line is sharing of medical information with something like a health information exchange should be mandated. It shouldn't be an option for a provider to be sharing information or not sharing information. And that's what leads to being able to get to those kinds of outcomes, because the amount of data we have is really incredible as an industry, but the largest holder of that data is Epic, simply because the number of hospitals that they have on board, but we don't have any real good centralized source of that information.
Yeah, no, but there's a lot of value to that information.
Yes, and that's exactly what the AI companies are realizing, right? Which is where they don't necessarily need to know that the specific patient's name was Mitchell Fung in order to be able to get value out of that data, but they're getting that data right now, and they're monetizing and selling that data, and we don't get a say in how that data is used.
Nor does it benefit us from a health standpoint.
That's right.
Because there's no reason why, so like, especially, primary cares may not want your data consistently of what you're doing, how many steps you're taking, what all your readings are. But maybe if you're under the care of a cardiologist, they may want to know how many steps you've taken that day, and what your O2 level is, and what your heart rate's been throughout the day as you've been doing those things. There's a lot of value to that data. The question is, how can it do the practices want the liability? Because if they receive the data and they don't act on it, now there's a liability.
But AI helps with that, and you kind of start with that point, Leo, about just about collecting the consumer data. You're right. We collect the data. We use our watches and our phones and count our steps, and then you go to the doctor's office and they say, "Are you exercising?" And then you lie to them. And they take your blood pressure, right? But it's that one moment in time, or your heart rate. That's information that, having the history of what your heart rate has been over an extended period of time, is much more valuable information. And AI can mine that data in very, very efficient ways and put that and allow the provider to know, here's something you should react to. You're correct that the liability is a factor and a consideration, right? But the data would make it much more likely that you're going to catch a problem. Because if you've got their heart rate 10 times a day for the last 60 days, that's much more valuable information and much more actionable information than what the heart rate is at one particular moment in time in the doctor's office.
Absolutely, and it may be influenced by white coat syndrome. I know a lot of people, when they're getting their blood pressure and their blood pressure is 20 points higher, when they're in the doctor's office than when it's at home. Yeah, it's strange, and it's oftentimes because the nurse is talking to you while they're doing it, which is elevating your heart rate, depending on I'm not going to say it, but so from a obviously a typical primary care or specialist is not going to build their own solution. That's not their expertise. If every doctor goes out there and spends time building these solutions, they're not going to be all adopted. It's going to be a massive waste of time and labor. So it really needs to be a little bit more central, or someone that wants to be in that business. So it's just a question of who is going to take on those tasks and who's going to win.
Yeah, and I think getting back to what you guys were just talking about, the data and it's how important it is to share it. It's also about what's meaningful for what you need today and how are we going to use that data, because it's extremely powerful as we want to get to prescriptive medicine by using data to make it extremely personalized. To your point, Leo, there's a concern about liability. If I have all this data, what am I doing with it? How am I using it? But then on the flip side, to what Brian said, if I have the history of all that data and there is a need, then how can we use that to trend and look for opportunities to really personalize your care? So I think it's really important that we look at what's the value proposition as far as collecting the data and sharing the data. But I think it's extremely important that we have access to the data, because what goes undiagnosed or undetected is nothing that we can treat or get upstream on. And so the ability to have the data and have those readings is extremely important. But I think on the consumer side, it's really focused on how do you control the data, and where it goes, and how much influence do you have in making sure that your care providers, the people that you trust getting care from, have access to that data and it's interoperable so that they can use those records. I think that's the biggest challenge when we talk about those local tools versus larger tools. It's even with some of those smaller, I'll use EHRs, for example, they have a challenge in ingesting data from other EHRs. And so if that's already a challenge today from doctor office to doctor office, you can imagine when you start thinking about wearables that consumers are having, et cetera, and all these other readings you might get, how much more convoluted that data set will be. And what we don't want is the noise to be the thing we hear the most. We want to make sure it's very focused and value driven.
Mitchell, you made a really important point there that it's about personalization of care, right? That all of this that we're talking about is the data that we're talking about collecting, these consumer tools that are about creating a unique care experience for the individual. Having complete information, making the best possible decision for them. And ultimately, our industry has a challenge that we only have so much time with each person. We tend to think of everything very generically, that this patient falls into this category. But AI allows us to, without spending the time, to truly personalize care for each individual. And that's one of the reasons that consumers will use tools like a ChatGPT Health in the market, because they're going to see it as an opportunity to personalize their care. And I think that overall with sort of this question, Leo, about what people should be doing, what providers should be doing, I think it's important that we really keep a close eye on what's out there, see, experiment, try things, and do pilot programs, try out solutions. You're going to see things like EHRs putting out solutions, and those might be the natural way to go, but they're not always the right way to go. And I think part of it's about choosing the right ones, piloting them the right way, getting the right kind of feedback, and expanding those pilots. You see a lot about AI failures in the news and everything, and a lot of times it's because those programs aren't properly supported. They're seen as an IT project when it's really a change management project, and we need to do more to just to get ahead of this as an industry instead of being reactive to it.
Some of it, there's also a lot of hype. Part of it is education. The typical patient doesn't understand that when they sign up and they have a free Gemini or ChatGPT account, that they're not a customer of those companies. They're the product. So when they're doing their free searches and they're putting in, hey, my blood pressure is X, what does this mean? Well, they're divulging their personal health information. There is no security, there is no privacy when it comes to those solutions, unless you have a higher level account. And even in some of those, some of the AI models have been caught still being trained on that data. So there's that piece of education of where is it safe to put your data. And the second piece of that is that every single time AI makes a mistake and that causes some kind of a negative outcome, it's going to be highlighted in the media. It's kind of like if a self-driving car gets into a car accident, that's front page news. When I get into a car accident, that's just Tuesday. So the fact that the self-driving car got into a car accident because it got cut off and no human being could have avoided that is not really discussed. It's that this this technology solution caused a problem, is what the headline is. So this is going to happen a lot going forward with AI, and that's something that people really should understand.
I'm not getting in a car with you, Leo.
At least not on Tuesday.
Yeah, make good points though. I think it's right that the AI is going to make mistakes, and it's going to be all over the news when it does. Just like what happens to self-driving cars, it's just that's just the reality of it. And there's a book that I used to require as reading on my Epic implementations called The Digital Doctor, which tells the story of an Epic implementation where a nurse overdosed a patient because a decimal was put in the wrong place in the setup of a particular medication within Epic. And as a result, they gave 100 times the dose they were supposed to, or something to that effect. And, I think that obviously some of that makes big news. Patient survived, but it's certainly an avoidable situation. But ultimately, somebody gave them that dosage and didn't question what the EHR said. There was a human in the loop that ultimately made an error there. And human in the loop is going to continue to be a part of what we would do in our industry, and what I think we need to do with many, many cases of AI use that we validate, right? We don't blindly accept information, and we shouldn't do that as humans. AI hallucinates, people hallucinate. And so I think there's always that responsibility. And to Thomas's point, there's liability attached to everything that we do, whether we use AI or we use open evidence or we use our EHR or we make it up. We're accountable.
Absolutely.
I'd like to echo that point. AI is really, it's not unbiased. There's biases. It's really the human using it ultimately should have some kind of responsibility, right? If I just prompted it incorrectly, or I misunderstand it, is it on the AI or is it on me? So ultimately, we have to come back to the point of, how did the human use it? What was their intent? Was there any bias? So that's the AI is never going to be autonomous, or you don't want it to be autonomous and all omnipotent and making all your decisions for you.
We don't want to turn on Skynet.
You want to be eliminated? Yes, the world's going to soon be digital twins instead of living, breathing flesh and blood.
Yeah, I would echo and support what they said. I think the human in the loop model is important as we think about bias, knowing that there's inherent bias in the model just based on however it's trained. Are important things to know from a consumer perspective as you're using it. Think about that, because as the clinicians, the care teams, the insurance providers, these are the models that they're looking at, and how they're being trained is to really create a human in the loop model that the AI is supporting the clinical team, but empowering them by taking some of the tasks off them. But ultimately, those decisions of diagnosis, treatment, et cetera, are in the hands of the physician. So if we think about that model and we think about that from a consumer perspective, how do we put those same safeguards in when we're going back to your first question, going to self-diagnose? Well, think about that. That's just the information, but we should make sure that we're getting to the final source of truth, that expert, that human in the loop, to make that final diagnosis. But this will get us 80% on the way closer to narrowing the scope potentially, and that could really streamline the conversation. So I think it's really important, those factors that they said. And from a vendor perspective, I heard this analogy at HIMSS and I really like it. It's kind of thinking through from a technology. Are you the road or are you the car? And I think right now we're seeing a lot of AI companies trying to figure out, am I the road, meaning am I enabling data interoperability across different tools, et cetera, and maybe I capture a component of it, or am I a car that's being able to take all this data, ingest it, and actually create algorithms, recommendation, automate tasks, et cetera. And those are very different things. So as you're looking at consumer-facing tools, I think about what's that infrastructure, that digital highway that I need to be empowered, and do I trust those vendors? Particularly, we want to make sure that the road is stable and has the appropriate infrastructure so that many cars can drive drive on it. But then we want to know which car we need to get in today based on what our need is. For example, if I have a large load to haul, I'm probably not getting in a sports car. But if I need to get somewhere fast, I'm also probably not getting in a tow truck. But we need all those different types of vehicles on the road for what we'll need from a clinical application and from a consumer application.
And it's sort of realize when you mentioned bias, such that AI has bias because people have bias, and that's just the reality, and the data comes from us. So and ultimately, you can't tell me that a doctor who has 6 minutes to see a patient before he has to get to the next one, and sees a set of symptoms and doesn't have some recency bias that the last 5 patients I saw with similar symptoms had the flu, so this guy probably has the flu too, that doesn't have some aspect of influence on their decision because they can't spend the time to look at their entire medical history in that moment. But AI can, and it can say, oh, by the way, you might want to consider this. And so it's not necessarily an issue of there's bias or not, because I think we need to recognize that humans and AI both can have bias. It's a question of the automatic second opinion that comes with it, as long as we keep the human in the loop. And the potential third opinion, if it is a combination of clinical tools that they're already using with the doctor, with the patient, with these other AI. We have multiple different sources now, all confirming, and that's just I think an important element of this, and it goes kind of touched on this idea of these companies out there trying to create solutions, and I think important to realize when people think about is AI a bubble? AI is absolutely a bubble, not in the sense that AI is going to go away, in the same sense that the internet was a bubble 25, 30 years ago, where all these .coms came out and everybody was raising tons of money because they were .coms. And as a result, there was the big bust and all these companies went out of business, and stocks dropped and everything. Well, every company is a .com now. Email is just a part of how we do our jobs, and AI is going to be there sooner rather than later, right? But a large number of these companies that are out there right now selling AI are not going to survive. And I think the key differentiator between the ones that survive and the ones that don't is going to be the ones who are out there, who are hammers looking for a nail, people who had an idea, created something, and didn't actually validate the market or don't really understand the market. And we see them in healthcare all the time, that they don't really understand our industry and the unique aspects of our industry. They're going to fail. The people who solve specific problems that we have in our industry with solutions are going to succeed.
Yeah, I'd be curious if anybody has an opinion on, so we've been kind of talking about the US model. In a lot of other countries, people self-diagnose, then they go to the pharmacy and then they buy the antibiotic that they think they need. And they don't need a prescription. There's not really much control there. How does AI affect those, like, Central South America? I mean, it's like I stubbed my toe and I got a little cut on my toe when I was in Mexico and it started getting inflamed. I texted one of my clients. They said, get this kind of antibiotic, and I went and I just bought it. They're not without any control. So how do you see that affecting people in other countries? And then also, how do you see that affecting, potentially, antibiotic resistance and stuff like that? That can actually also get negatively affected by too much self-diagnosing. Any thoughts on that?
I go back to what I said before, that I feel like it's just now that they're making a more informed decision, right? They have better information, the capability for that to be well vetted with a discussion, and I think better prompting to, explaining to people that they don't just type in the ChatGPT, what do I have a cut, what do I do? But explaining the whole situation, right, and giving lots of detail, you're going to get better results. But I think it only reinforces that the chances of them making better self-diagnosing decisions are better, with better tools.
But better than asking grandma.
Better than asking grandma. Chicken soup.
Yeah, I agree. And I just think it validates the model that there is utility in having these consumer-facing AI tools. Just within our country, even though we want to do a human in the loop model, which I think is appropriate. I think it just validates that there is utility, there's value, and there's interest in people being more educated. And I think a part of that is also validation that there's access challenges across the globe for a lot of these clinical care services, these specialty services. And so how do we figure out how we provide support to everybody at scale? I think that's one of the beautiful things with technology and AI in particular that I'm extremely excited about is once we're able to use it effectively, we can really elevate the level of care that we provide to every person across the country, across the world. And so hopefully we're elevating and removing some of those disparities due to social determinants or whatever it is. So for me, that's kind of what my soapbox is, and that's what I'm excited about with the technology. I'd love to hear from Thomas because I know that you're kind of more familiar with different markets, I'll say, just from the work that you're doing.
Yeah, absolutely. Well, it's a cultural, economic, and legal. So different from the lens you look at it, right? Each country has the different ways they operate, and so we really can learn from the way other countries are approaching it, and we study how efficient or how effective their methodology is and adapt it. At the same time, the United States is great in that they are able to protect the consumer a lot better, right? There's a lot of rules and laws in place to where consumers don't get access to the wrong types of drugs and things like that. So, but really, as you mentioned, Mitchell, providing access is a challenge. Every country has different levels of access, and of course, the determining factor is who's funding these programs, right? So as it opens up, AI can actually make access to information and efficiency better. It will actually drive the cost down, hopefully, and be able to make it economically viable for someone in a remote area to now access the same level of care as someone who's in a big city and a beautiful hospital facility.
No, that's very interesting. And you had mentioned, cost. How do you see AI in healthcare affecting the price of healthcare, the cost of healthcare, especially when we're talking about the U.S. market? What do you guys see as the impact over the short and long term?
I guess I could jump in. Everyone has a little thought, but I gotta jump in with what I'm hopeful for is that we get closer to true price transparency and we really look at controlling what the actual cost of care is with different tools to be able to add that transparency and better understand what the real cost of delivering care is from that lens. How it will impact the cost of care in the near term, I'm really intrigued to see. I think what we'll see is kind of a shift in a battle between payers, providers of like using technology to use billing as an example. Providers might use it to maximize their billing, and then payers might use it to maximize utility and making sure they're appropriate services that they're delivering. And so we'll be seeing AI being added, which might create an influx, positive or negative, to the cost of care, but ultimately find a new stable medium is kind of what I hope. I don't know exactly how that will impact the cost of healthcare, but I do think that if we're able to increase the level of access to healthcare with technology, then we're going to be able to provide more care to people. And hopefully the long-term impact is we're able to deliver higher quality care at a more affordable rate. But I know that might be a little wishful and it might take some time for us to get there.
I think it's in many ways the key to, I think it's the key to us getting through the reality that we don't have enough people to provide healthcare in this country. We have an aging population, and since we can't figure out how to stop the aging, I think we have to have more capacity in our healthcare industry. We need to do more without necessarily scaling up the number of people to the same level because we just don't have them. And that as a result, I think that so many opportunities to make the back office more efficient, the front office more efficient, the patient care experience more efficient, make it more likely that people are going to follow through on what comes out of it, to do the proper care in between appointments, which means that they're going to be not need to use to be a consumer of healthcare as much. Mitchell, your point about price transparency will help to bring the cost down. All of these things, I think, are a part of making the industry more efficient, more transparent, and more accessible. Smart scheduling can be a part of that. There's lots of pieces of it. So I think this is why, as an industry, we have to embrace this and we have to use it the right way, and be smart about it. But I think it's the key to the future of the industry.
So, Thomas, any parting thoughts here?
No, no, great.
Down to the wire.
Actually, since I have 1 minute, the thing is, it will save time. Ultimately, as long as we have the right guardrails and the right data, and we have the information that we need to be actionable, saving time is saving money. And so there's value in that. So as long as we do this, efficiently, as you said, productively, and then the efficacy is there, right? The patients are getting the quality of care that they deserve. Then I feel it's a great tool, and it will get better. And we need competition. We don't want to have one or two, companies dominating the AI industry, right? We want to have a lot of good options.
Absolutely. And I think ultimately, Brian, I know you're really involved in the interoperability. That's ultimately what will save money, is lack of duplicate testing, lack of, killing the patient and having to revive them because you gave them something they're allergic to. Those types of things will save money in the long run and provide better care.
That's right.
And with that, I think we're at time. I'm gonna share a slide with contact information in case anybody wants to get a hold of any of the folks here on the call. And let me pull that up.
Encourage everyone to contact each of us on LinkedIn and keep in touch and attend events from HEALS, ACHE, and HIMSS and other organizations locally.
Absolutely. And again, thank you everyone for joining us. Really appreciate everybody's time, and enjoy. Have a great rest of your week. Thank you very much.
Thank you.
Thank you.
All right.